Hi friends, it's Dr.Waks, naturopathic physician, happily retired. Today we'll continue our education on the topic of digestive tract and the discussion on liver and gallbladder flash. Also, some website call it cleanse. Several of the clients contacted me and tell me that in the past they did liver flash, and next day they saw in the stool gallbladder stones. So they basically passed the stones. I'm here to disappoint you that it's unlikely that you've seen gallbladder stones in your stool. And I will explain you why. So in this video, we will talk about gallbladder stones. Are they get actually removed? And the answer is not likely. And the second is there actually benefits of doing liver flash or gallbladder flash? And the answer is yes. Before we go ahead and talk about the topic number one, you need to understand the anatomy of small intestine, gallbladder, and liver and pancreas. So on this picture, you can see there on the background is the stomach, and then it continues into small intestine. Here is a gallbladder. Also here, like a V-neck, is a bile duct that come from the liver. Liver bile duct and gallbladder duct join together and form a common bile duct. It comes out here into the small intestine. At the end, there is a sphincter ori. Also, you can see here on the picture, there is a duct that comes from the pancreas called pancreatic duct. Often it comes here into a common gallbladder duct. Sometimes it comes individually right here into the small intestine. Now, let's go and talk about on the blackboard why it is unlikely that you've seen gallbladder stones in the stool after liver cleanse. As always, I already pre-draw for us my favorite picture of the digestive tract. This is the mouth with the teeth, esophagus, stomach. This is the small intestine. This is the large intestine, and the food will move out right here. Liver is located right here. I will write liver. Gallbladder is located right under the liver. Liver has bile ducts, and liver producing bile almost constantly. What happened when liver produces bile? Let's see, let's draw it like that. It's joined with bile duct, and then it goes right, there is gallbladder duct, excuse me, and it goes right here into the small intestine. Because liver is producing bile almost constantly, but we don't need it all the time. What happened, this bile goes and stays here in the gallbladder. Also here we have pancreas, and pancreas drains here into the common bile duct. At the end of all of this, we have a sphincter ori. It's a narrowing, and it's real sphincter. It closes and opens on demand. Bile get produced here, and for unknown reason to us, sometimes quality of the bile is changed. So what happened, usually bile is pretty clear, but when the quality changed, bile becomes unclear, and it's called slash. Then also, because it is thick bile, the sand starts to form. Several pieces of sand get combined, and that's the formation of the stone. When the stones get formed, the condition called cholelithiasis. These stones could be different sizes, usually slash, and the bile sand are small. They are between 1 to 2 millimeters in diameter. Stones are bigger than 2 millimeters. And that becomes a problem because common bile duct only 2 millimeters in diameter. So that means it's a very small. Everything that bigger than 2 millimeters cannot go through the bile duct without not being noticed. Also because the sphincter uri is a narrow place, so it's a bottleneck. Often, anything that bigger than 2 millimeters gets stuck right here. So if stones are there and they start to move, the first obstacle is the narrow common bile duct. Then they could be stuck right here by the sphincter uri. Both conditions will create a severe problems. In first case, the bile will back up in the gallbladder and will create cholangitis, inflammation right here. Also, that bile can go into the liver and will create inflammation of bile ducts here. Inflammation of bile ducts here and here, called cholangitis. So cholangitis, inflammation of bile ducts, cholangitis, inflammation of gallbladder, and cholelithiasis, stone formation. When the stone gets stuck right here by the sphincter uri, not only bile will go back, also bile and juices from the pancreas will go back into pancreas and will create inflammation or pancreatitis in the pancreas. So, in the nutshell, the stones, because they are bigger in diameter than 2 millimeters, they get stuck here. They cannot be seen. They cannot pass through sphincter uri. So what you see next morning in your stool right here that came out of here is most likely globes of the fat that you took in a last day or in the evening before, because the fat is actually, when you swallow that here, it drops here, it comes here, and it precipitates minerals. Usually it is combination of fat, calcium, magnesium, and iron. And that's what you see the next morning. I also want to say a couple more words about that. A liver cleanse. By definition, it is stimulation of the gallbladder, and it's done by the means of the fat, because fat is necessary to produce bile. When the fat arrives in the digestive tract, it's a signal for the liver, start to produce bile. It's a signal for the gallbladder, start to release bile. Okay, because bile arriving here will help to emulsify fat. And emulsification of the fat means that fat will get broken, and it will get absorbed through the digestive tract in the bloodstream. That's the purpose of bile. Okay, I said that. Now let's go back to the PowerPoint presentation. Now let's talk about point number 2 in this presentation: benefits of liver flash or liver cleanse. When person become aware that there is a problem with gallbladder and with the bile, they tend to start to change their diet. I love when people do that, because diet is the main cause of sludge, biliary sand, and basically all sediments that get formed in the bile. Also, when people do cleanse, so they consume olive oil, grapefruit, lemon, sometimes they take magnesium. So all of that will stimulate production of digestive juices and will start to move the food through the digestive tract. I love when the food is moving through the digestive tract. So that could be also beneficiary for our digestive tract. When people do liver flash, gallbladder sludge, biliary sand, biliary sediments, and thick bile actually will start to move, and that by definition will prevent the formation of the stones. Here on the right, you can see the picture of the gallbladder. It's done by ultrasound. Gallbladder is here. Bile is usually clean. Here you can see sludge. It's not very clear. And there's a stone that gets formed. Couple more ultrasounds. Ultrasound is a gold standard test for all kind of gallbladder diseases. So you can see on this picture the gallbladder. You can see some bile is clear. There is a sludge start to form, and also you can see the sand is forming here, and here. And because sand tend to accumulate, it's already forming a stone, and you can see a couple stones right here. On this ultrasound, you can see again gallbladder, and technician actually pointed to us that person has probably had or has cholangitis, inflammation of the gallbladder, because the wall of gallbladder is thicker. And here you can see a stone that gets stuck right by the entrance or exit from the gallbladder and blocks the exit from the gallbladder. Okay, and also on this ultrasound picture, you can see that it's been measured, the wall, showing that there was a past history or there is right now inflammation in the gallbladder. Warning. So if you're thinking about doing liver flash or liver cleanse, it's a good idea to be aware if you have anything in the gallbladder bigger than 2 millimeters. If something is bigger, it will start to move, it will block the gallbladder duct, and you will can create a bigger problems. Also, if person has inflammation in the digestive tract at the moment, such as acute gastritis, irritable bowel disease, diverticulitis, cholecystitis, liver flash is a contraindication. Why it is so dangerous to move stones actually out of gallbladder? Not only they can block the stone, that's the one problem. When they block, and by the way, we do not know why some patients do have this problem and the other don't. Here's the problem. Between the gallbladder and the heart, there is a connection, like some kind of nervous connection, and it's called cholecystocoronary reflex. What that means is when the person has severe inflammation in the gallbladder and it becomes painful, person in pain, the signal sent to the heart, and the heart receives the signal, and it somehow signals that the blood vessels that supply nutrients and oxygen for the heart, they contract. Because they contract, the supply of oxygen is diminished to the blood. And when the blood supply is diminished, then it becomes an ischemia. It could be converted into myocardial infarction. As I said it again, we do not know which patient will get converted into myocardial infarction. So as a result, most of the patients that arrived into emergency room and get diagnosed with gallbladder stones or cholelithiasis, so they offered surgery immediately, and usually surgery is performed to control this problem. So that's it, guys, for today. If you have any questions, please ask me. Otherwise, like, subscribe. If you need a health coach, just contact me through my website. That's it for today. Bye-bye.